Well,
Hi, how are you?
yeah, not too bad, thank you. How are you?
I'm very well, thanks.
So, I think you wanted to have a chat with me about continuing healthcare. Tell me what the problem is.
Well, I just really wanted to know a little bit more about it, about what it's all about. I've heard the phrase, obviously, and that this is what you specialise in. But just first of all, a little bit more information about what it is.
Yeah, no problem. Have you been on Google and had a little look around?
I had a little look, but it can be very confusing when you trying to search for something. So I thought asking you, you might be able to give me a clearer idea.
Yeah, no problem. So, first things first, get yourself off to have a look at the National Framework for Continuing Healthcare. The latest one is 2018, is the year it was produced. It's the guidance that sets out what clinical commissioning groups, the NHS bodies who assess eligibility for continuing healthcare, it sets out what their responsibilities are. Now it's long and it's complicated, so don't put pressure on yourself to get your head around the whole thing. But it does certainly at the beginning explain what eligibility is and how it's assessed. So generally speaking, a lot of people don't know about NHS continuing healthcare, but broadly, it is a package of care which is fully funded by the NHS. And in practice, what actually happens is, in addition to paying for the fees for care, whether in a care home or at home or in another setting, the NHS also takes legal responsibility for your care package and reviewing it and making sure that you're safe and well, and that your care support needs are being met. And it's available to people who are assessed as having a primary health need. Now, that term, primary health need, is an important one. It isn't clearly defined in law or anywhere really. That national framework document will explain what a primary health need is. And in essence, you have a primary health need if the majority of the care that's needed to meet your needs gives rise to intensity, complexity, or unpredictability of need. Assessors basically have to look at the type of care you're getting, the level of skill that's involved in meeting your needs, and they have to make a judgment as to whether that means your nursing needs are the majority of your care and therefore you're eligible for continuing health care. Does that make sense?
Yeah, it does a little bit. So, for example, if I or one of my relatives had dementia, would that constitute a primary health need, and would I be able to get continuing healthcare for that?
Well, that's a really good question, because a lot of people say to me, well, dementia is a recognised medical condition. So because it's a medical condition, surely it's a health need, and therefore I'm eligible for continuing healthcare. The difficulty with this is, and the national framework's very clear, that eligibility isn't diagnosis led. And what I mean by that is, they don't want to get into a trap where you're in a tick box. So you've got that condition, therefore you're eligible. You've got diabetes, you're eligible. You've got dementia, you're eligible. They don't want to get into that trap. They want to look at the care that's needed to meet your needs. So many people who have dementia will qualify for continuing healthcare, but they'll qualify for continuing healthcare on the basis of the care they need when looking at things like their skin integrity and what care is needed to manage that, their mobility, their cognition, the extent to which they understand basic risks and can communicate their needs. All of those things are taken into account. And of course, that differs from person to person. Yeah. Your diagnosis might indicate that you have certain needs. So, for example, if you're diabetic, assessors should be quite carefully looking at your nutritional needs. But even within the spectrum of diabetes, your diabetes might be relatively easily managed with diet. Or it could be actually that insulin is needed to control your blood sugar levels, and there could be all sorts of other consequences around that skilled management that potentially makes you eligible for continuing healthcare. But it's a professional clinical judgment that assessors make based on that criteria set out in the national framework.
Right, okie doke. And are there any needs that they set out that say if you have this need, you will definitely qualify?
Absolutely not, I'm afraid.
So it's based on individual.
it's based on a unique individual and very detailed assessment of need, and the assessors will complete a document called a decision support tool, sometimes called a DST for short, and that can be found on the internet as well, on the Department of Health government website. Perhaps we could pop some links below to these in the video, but that requires them to go through all these different care domains to make sure they capture the person's needs. What the national framework does do, which is a new addition, which is quite helpful, is it makes this distinction between health needs and social care needs, and this is how the assessors come to a decision that your primary need is healthcare. They have to weigh up your health and social care needs and make that judgment. And it lists social care needs. So these are needs that don't strictly qualify you for NHS continuing healthcare, because social care needs can be met by the local authority under its means tested system. And social care needs are described as things like personal care, washing, dressing, protection from harm. And this is why people who are assessed for continuing healthcare might feel disappointed or confused that, you know, my relatives in a 24/7 care environment, how can that not be a primary health need? And the answer is, you can be in a 24/7 care environment, but that the majority of that care provided could be for social care need, personal care, etc., etc. So no, there is no specific definition. That decision support tool I mentioned, when you have a look at it, there are various scores in different domains, and there are a few combinations of levels of need or scores that will potentially automatically qualify you, but it's never necessarily as straightforward as that.
Okay. So if I wanted to look at getting continuing healthcare for my relative, what would I need to do? Where would I start?
Another good question. So first things first, you need to identify which clinical commissioning group, or CCG for short, which NHS body is responsible for commissioning the care and funding it in that area. The easiest way probably to find that out is to call the person's GP, because every GP surgery will be attached to the relevant clinical commissioning group, and sometimes you can't make assumptions. The geographical borders aren't, they're not like county borders as we would know them. So that's a quick way to find out. NHS Choices website, if you look at the GP surgery as well, some of them confirm which CCGs publish the info. Once you've got that CCG's details, you can then get their contact details, and you can ask to speak to, either by phone or in writing or email. You can request an assessment anyway, but you need to speak to the continuing healthcare team. Failing that, any professional who knows about continuing healthcare can request an assessment. A social worker can instigate the process of an assessment. Being a solicitor, I come across people wanting advice where things go a bit wrong or they hit a brick wall for whatever reason. And I have seen instances where clinical commissioning group continuing healthcare teams will say, oh, no, we need a referral from a social worker or something like that. Not strictly true in my view, but often it's about, you know, what's the quickest and best way to get an assessment arranged for this person. But it's the sort of thing that we can offer guidance on here at Ridley and Hall if people get stuck.
Lovely. And just very quickly, how long does the assessment process usually take?
Well, it varies. So the process tends to involve an initial screening process, which is called the NHS checklist. Again, that's another document that can be found online, and we'll post a link below the video. If that screens the individual into the process, it's got a low level threshold. It's intended to make sure that anybody who needs an assessment definitely gets one. And once you've screened in, you then move on to have the decision support tool completed. The national framework states that that should happen within 28 days. Unfortunately, because of NHS resource, it frequently doesn't happen within those sorts of rapid timescales. But normally what happens is, if the person is then eligible for continuing healthcare and is awarded their fees paid on an ongoing basis, they would usually backdate to day 29 to make sure that they rectify that delay. Other than that, the best thing to do really is to ask the CCG to give us clear information as possible about timescales, because it does vary depending on staffing. Obviously, following, you know, the pandemic, we're all sensitive to, you know, NHS staffing levels and the question of applying resource to these things. But equally, you know, when somebody has a need, that the CCG is a public body and does need to address that need promptly.
That's lovely. I think that's probably all that I wanted to know for now, unless you think there's anything else that I need to know about these early stages.
I think that's probably enough for you to go on for now. But if there's anything else, you know where I am. Just give me a call.
Brill, thank you.
Take care, Michelle. Thanks.
Bye.
Bye.